Hello, I am Dr.Priyamvada Shah. I am a senior obstetrician and gynecologist. My special area of interests are high-risk pregnancy, infertility and laparoscopic surgery. I am currently practicing at Cloudnine Hospital, Pimple, Saudagar, Pune. So let's discuss something about obesity in pregnancy. Nowadays, it is not uncommon to have little bit of excess amount of weight. So how do we define obesity? We define it with respect to the body mass index, or commonly known as BMI. If the body mass index, that is weight in kg upon height in meter square, is more than 25, it is labeled as overweight patient. If the BMI is more than 30, it is called as obesity. Now, it is a common lifestyle disorder these days because of the sedentary lifestyle, where the exercise is not much and you have to sit for a prolonged time for your working pattern. So whenever pregnant woman whose BMI is more than 30, we label it as a high-risk pregnancy. Now remember that in a normal pregnancy, the total weight gain is around 11 to 15 kg. However, if the BMI is more than 30, we do not allow this weight gain up to 11 kg. Only weight gain until 5 to 9 kg is recommended. So how do we achieve it? We need a good team of dietitian and nutritionist, where careful diet will be prescribed so that the woman is not deficient in calories, but she'll get adequate nutrition from the proteins and fats instead of carbohydrates. So the role of nutritionist is very important in managing the diet portion of the obese girls. Now we have seen that in these obese girls, apart from being overweight, there are associated conditions which are commonly there, like diabetes or hypertension. So if the patient is already diabetic and hypertensive and she is taking any medication in the first trimester, for these obese patients, we shift her to the safer drugs which are allowed in the pregnancy. And the first trimester abortions are little bit on more side, or the incidence is more. So we are more careful in giving treatment to these girls. As the pregnancy advances, it is many a times difficult for the patient to perceive the fetal movements because of the abdominal fat. However, certain ultrasound investigations done at proper time will take care of it, so don't worry. As the patient reaches near term, if the pre-existing conditions are not there, she is more likely to have diabetes and hypertension. So a careful diet and appropriate medication has to be started towards the third trimester. Now, delivery in obese girls is also a great challenge for us because there is lot of fat deposition from inside the pelvis as well. So the engagement of the head becomes a problem for these girls. So as epidural analgesia. So the chances of cesarian section or instrumental delivery are much more in obese girls as compared to a normal patient. Also, the cesarian section is not free of risk because the anesthesia involved, may it be spinal anesthesia or general anesthesia, has more challenges for obesity and needs certain different instrumentation also to give the anesthesia. After delivery of the baby, we give usually something called as thromboembolism prophylaxis to obese girls so as to avoid venous thrombosis in these girls because they are more prone for the venous thrombosis. Wound infection and wound healing becomes more problematic in the obesity. So in nutshell, obesity is definitely a high-risk pregnancy. Whenever a patient comes to us before pregnancy, we always ask them to reduce weight so that all these complications can be avoided.